Hi. In the last two videos, we spoke about what is rheumatoid arthritis, what are the symptoms of, and how to diagnose it. Today, we'll be speaking what are the treatment options. There is a common misconception in our community that rheumatoid arthritis does not have any treatment in modern medicine. Why did this misconception come in the community? 25 to 30 years back, science did not know why does rheumatoid arthritis really happen and what are the pathways involved. So, there was not much treatment options available. People used to treat rheumatoid arthritis with painkillers and steroids, which obviously have a lot of side effect. So, people used to resort to other systems of medicine like Ayurveda and homeopathy for the treatment of rheumatoid arthritis. In last 20-25 years, due to developments of the field of rheumatology and immunology, modern science have figured out what are the pathways resulting in the rheumatoid arthritis, which has resulted in development of new drugs, which are called immunomodulatory drugs. What does immunomodulatory drugs do? They act on the immune system in such a way that the immune system starts functioning normally. As we told in the last two videos, it is an autoimmune disease and the immune system is what is responsible. Unless we correct the immune system, the rheumatoid arthritis will not get treated well. So taking local lotions, applying ointments, or taking painkillers is not going to help. These are only of temporary benefit. So the most common immunomodulatory drugs are called disease-modifying anti-rheumatoid drugs or DMARDs. They are called disease-modifying because they change the way the rheumatoid arthritis, the course of rheumatoid arthritis. Commonly used DMARDs are methotrexate, leflunomide, sulfasalazine and hydroxychloroquine. These are the four drugs, of which methotrexate is the most important. It's a once a week tablet. If used in a correct dose, these disease-modifying drugs in a combination, sometimes you have to give two drugs in a particular combination, depending from patient to patient, which combination you choose differs. With these drugs, if given in a proper combination, they are very, very cost effective and can control the disease in more than 75 to 80% of the patients. And the cost of therapy is much less, 30 to 35 rupees per day. But the thing what you should understand is that disease modifying drugs has to be taken under close supervision of rheumatologist. Why? These drugs can act in some patients can develop certain side effects to these drugs, less than 5%. But unless monitored, this cannot be picked up. So regular blood testing has to be done and doses has to be modified based on the blood results. Unless you do, what happens in our community is patients come to the doctor, they start taking drugs. Once it is controlled, they from the nearby shop, they will keep on taking the same drugs. By doing so, sometimes side effects will not be picked up and patients will be overdosed. They will be taking a lot of drugs unnecessarily. So it's extremely important that even if the disease is controlled, you visit your rheumatologist in a regular interval and adjust the doses. Sometimes, as I told you, these drugs are effective only in 80%. What do you do with 20%? There are newer medicines which are called biological medicines. What are biologicals? Now we know which are the cells which are causing rheumatoid arthritis. We know which are the cytokines which are responsible. So these drugs are developed to target against these cells and cytokine. These drugs are slightly on the expensive side, but now the prices are coming down. With these biologicals, another 20 to 25% of the patients, if the disease is not controlled, with DMARDs, the disease can be, these biological drugs are usually very effective in the treatment of these people. And there are certain patients who are not responding to these two. For them, there are very new drugs which are called small molecules, which are oral tablets. Once you take them, they go into the cell and inhibit a pathway called JAK-STAT pathway. They are called tofacitinib and baricitinib. They are slightly on the expensive side because most of them are imported now. They are also very, very effective. So the message is, with these class of drugs, 99.9% of rheumatoid arthritis patients can lead a normal life if diagnosed early. Even if it's late, 95 to 98% of the patients can be very well treated with these drugs. Only problem is they have to take drugs properly in a proper dosage prescribed by a rheumatologist. And more importantly, these drugs have much less side effects when compared to steroids, and also they are very, very, very safe when compared to non-steroidal anti-inflammatory drugs or painkillers. The role of painkillers in the management of rheumatoid arthritis is almost zero now. If a patient with rheumatoid arthritis has to take an NSAIDs or a painkiller, it indicates that the treatment needs to be changed because disease is not well controlled. So the role of NSAIDs is almost gone. You should never, people don't use NSAIDs in the treatment of rheumatoid arthritis. So if you have rheumatoid arthritis, no need to worry, no need to get depressed. What you should really do is consult a good rheumatologist, take a proper treatment in a proper dosage so that your disease is completely controlled. And most of the time you can lead a completely normal life and never overdose yourself. Go to the doctor on a regular basis, 2 to 3 months or 4 months, and adjust the doses based on the blood test, and have a pain-free life. Thank you.